we need to talk about something that's both urgent and, for a lot of people, really personal. And that's the pretty shocking rise in mental health challenges among young adults. Some new research has laid out the numbers, and they are stark. So in this explainer, we're going to break down what the data is telling us and dig into the complex forces driving this trend.
So let's just jump right in with a number that is, well, it's staggering. In just a single decade, from 2011 to 2021, the rate of young adults who reported a major depressive episode more than doubled. That's right, an increase of over 100%. This isn't just some small blip on the radar, this is a massive, seismic shift.
And that just begs the question, right? What is going on here? What has changed so profoundly in the world of young people to cause such a dramatic spike? That's the core question we're going to tackle, using the latest research as our guide.
To really get a handle on the scale of this, we've got to look at the data that defines the problem. Let's look at the trend line.
When you look at the timeline, it tells a really consistent and frankly troubling story. Back in 2011, you had about 1 in 20 young adults reporting a major depressive episode. Fast forward to 2021, and that number jumps to more than 1 in 8. And you can see this isn't a sudden thing. It's a steady, decade-long climb, which really suggests there are some deep, systemic factors at play here.
Okay, so we've seen the what. The numbers are clear. Now for the really tough part, the why. Researchers have started to untangle this complex web of factors, and it looks like we're dealing with a perfect storm of modern pressures. And the first place they're looking is probably exactly where you'd expect, our phones. The constant presence of smartphones and social media has completely reshaped what it means to be a young adult. And that timeline of rising distress, it maps almost perfectly onto the era when smartphones became a part of everyday life for basically everyone.
You know, social media is this classic double-edged sword. It's a totally normal part of life for the vast majority of young people. But over a third of them say it's actually bad for their mental health. And here's the crucial part. Studies that track people over time are now showing a link that more frequent social media use is associated with worse mental health down the road. And it's not just about comparing yourself to others, it's also about having this fire hose of distressing, divisive news aimed right at you 24/7. That's a huge stressor.
But look, it's not all happening on a screen, right? The second major factor is the immense weight of real-world social and economic pressures that this generation is facing.
And we really have to remember, these aren't just abstract headlines in the business section. They are direct sources of stress and anxiety. Young adults today are trying to build a life in a world with widening income inequality, staggering levels of student debt, and a housing market that just feels impossible. Researchers call these social determinants of health, and they basically create this constant, low-grade hum of chronic stress in the background.
And then there's this other layer of stress. It's a big one. And it's pretty unique to a generation that's trying to imagine their future 30, 40, 50 years from now. I'm talking about the state of the planet.
I mean, just look at these numbers. A global survey found that a whopping 84% of young people are moderately to extremely worried about climate change. That's almost everyone. This feeling even has a name now, climate anxiety. And it's a very real, very widespread emotional burden that just adds another layer of existential stress.
Okay, so we've got technology, the economy, and climate change. That's a lot. But there's a really interesting plot twist here that researchers are looking at. They're asking, is all of this a true increase in illness, or is some of it because we're just talking about it and reporting it more? This is what's called the destigmatization effect, and it's complicated. On one hand, it is fantastic, absolutely fantastic that we're more open about mental health and it's less taboo to ask for help. But the complicating factor for the data is that this also means people might be more likely to recognize and report symptoms they might have just ignored in the past. There's also this idea of social contagion, where talking about symptoms in social circles becomes more common. Now, this doesn't mean the crisis isn't real. It absolutely is. But it adds a really important layer of context to those rising numbers.
So given this whole complex picture, what in the world do we do about it? Well, the good news is researchers are proposing a really clear two-pronged approach to start tackling this crisis.
And the framework is pretty straightforward, but also really powerful. First, you have to go after the root causes to prevent the distress in the first place, or at least lessen it. And second, for everyone who's already struggling, you have to make it way, way easier to get assessed and treated.
So that first prong, prevention, is all about being proactive. We're talking about public education on fundamental things like coping skills and sleep hygiene.
It means training people to have a healthier relationship with technology. And on a bigger level, it means backing policies that actually tackle those social determinants of health we talked about. Things like access to health insurance, affordable housing, and the student debt crisis.
And for the second prong, treatment, the name of the game is accessibility. It's got to be easy. It's got to be welcoming. That means offering services where young people actually are. It means keeping up the fight against stigma, because young adults are still less likely to seek treatment than older folks. And this is a big one. Our clinical checkups need to evolve. They have to start including questions about modern stressors like social media use and climate anxiety as part of just routine care.
All right, so we've looked at the what, the why, and the what now. Let's just zoom out for a second and talk about why this is all so incredibly important. Honestly, the researchers behind this work say it best. They write that this situation calls for action by public health and mental health systems, providers, and policymakers. In other words, this isn't just an interesting trend to watch from the sidelines. It's a fire alarm, demanding a coordinated response from pretty much every part of our society.
And that really leaves all of us with a huge question to think about. This is bigger than just a policy debate. It's about our communities, our friends, our families. The real challenge for all of us is to figure out, how are we, collectively, going to build a world that actually supports the mental well-being of an entire generation?